Paramedic practitioners are there to treat patients closer to home. Many patients who call 999 don't need to go to A&E with various conditions such as minor injuries or minor illnesses, and the PPs themselves are skilled to provide better assessment and specific treatments for those patients. As the paramedic practitioner education pathway developed, we were fortunate enough to be able to place our student practitioners in a GP training practice, and those early experiences have built into what is now an intrinsic part of the education programme for PPs.
The Paramedic Practitioner programme came about because back in 2007 there were a number of important articles, both in the BMJ and government articles bringing care closer to the patient, that identified that very many worthy attempts at developing an advanced paramedic grade, a specialist paramedic grade, were not working. There were different curricula, there were different teaching programs, and there was no unified assessment of competence. Some 90 to 95% of paramedic practitioner work actually is not picking people up off the road and blue light calls. It is dealing with acute, undifferentiated presentations in a community, which is the very essence of general practice. This paramedic practitioner program has been successful because it is based purely on a medical model. This means that the GP postgraduate deanery and the external assessors, who are the Royal College of General Practitioners, are right behind this. They've assessed this on the exam, which has been developed by the paramedic practitioners themselves on 2 occasions, and have found this to be fit for purpose and is recognisable by medical colleagues as well as the public and the profession.
The paramedic practitioner placement has allowed me to consolidate skills that I've already learned within an academic environment and take which the knowledge that I've gained from GPs and allow me to go out and treat patients who fit into an urgent care kind of setting out in the community.
It's been tremendously useful having paramedics in the practice. They're able to contribute to the workload of the practice, which obviously is useful for us because there's an insatiable need for healthcare, but also they bring a different perspective which is useful for us to reflect on in terms of how we're providing services for our patients, particularly the ones who may or may not need to go to hospital. The benefits for the paramedic practitioner of working in the practice include improving their communication skills. They also have an opportunity to work on their examination skills and to just generally experience the wide range of presentations that patients come with, because they're very experienced in emergency presentations, but much less so in the things that are slightly less urgent. So it's very useful for them to understand much more about how general practice works and what we can offer.
The placement has been really beneficial. It's allowed me to interact with large amounts of patients with various medical conditions, which in turn has really helped me feel more confident and have a much better skill set.
It was a great opportunity to be a supervisor to the paramedic practitioners whilst I was actually training here at the surgery myself. Not only was it a great insight into training in the future, but also it helped me with my leadership skills, and they were invaluable members of the team.
The administration for the paramedic scheme is really easy. It starts with the practice putting in their expression of interest to the deanery. From that you get the paramedic practitioner's name, and then you contact them by email. We put a short induction programme together for them, and then when they start we complete a service level agreement and an honorary contract, which are all pre-prepared documents, so you don't have to do anything but put your practice details in, put your claim form in, and then that's it. That's all the administration that you have to do as a practice.
The future advantage the paramedic practitioner programme will bring is a close partnership between the ambulance service and general practice. This is particularly important for our patients, providing unscheduled care and urgent care in the longer term. I recommend this programme to other GP colleagues because it is one of the most enjoyable and satisfying examples of interprofessional education that can be undertaken.
The feedback from surgeries that have had our paramedic practitioners on placement is overwhelmingly positive, and we know it transforms our staff. We're looking for more training practices across Kent, Surrey and Sussex to help support our staff to provide the best possible care for our patients.